episode of So Portable, and today's episode is very, very interesting. I have an amazing guest with me, and she goes by the name of Dr. Arshni. She's an aesthetics doctor. Dr. Arshni, welcome to So Portable.
Thank you.
So what exactly does an aesthetic doctor do?
Well, as I was saying in the morning, I'm that time machine that makes you look 20 years younger or makes you feel 20 years younger. Yeah. I specialize in hair transplants, non-surgical facelifts, and antioxidant therapy and stem cell therapy. So this is my main forte. Of course, way much more than that, but this is what I mainly do.
So you work at Tia Clinics, right?
Yes, I own Tia Clinics.
All of that?
Yes, I practice all of this here.
Amazing. So if you're one of those people who just makes a flight to go abroad, just know we have Tia Clinics right here.
Correct.
So I've seen a lot of interesting things on your page, social media, what goes on around here. So let's start with hair transplants. Mm-hmm. Quite interesting. What are the risks? What are the risks when one decides that they need to do a hair transplant?
Actually, there's no risk. It's a natural procedure. Yeah. It's a natural hair restoration. Mm-hmm. So we're only taking your own hair from the back of your head and replanting it in the area of baldness. So it's done for males and females, and men who bald standardly, and female who bald from traction because of braiding and weaving and wearing extensions. So when you've lost that hair is when now we naturally restore it for you.
How long does it take for one to heal?
The healing process is about 7 days, but there's no such, no like bleeding or, dressing or anything like that. Yeah. It's just that the area where we remove the hair from is a bit raw. But the process itself is 2 days. It's an outpatient process. So you come in the morning, you leave in the evening, and then do the same the next day.
So it's nothing like serious. You just come in, you just get your hair transplant done. After 7 days, your hair started growing?
Yeah, no. After 7 days is when you've healed, and the hair starts growing after 4 months because it's a gradual process. Yeah. And then it grows up to 1 year, where that's the full density or the full length of the hair. Yeah. And then now it just continues naturally to grow, so you can cut, style, do whatever you want. But it takes 1 year to fully grow out.
Okay, is it prone to things like infections and hematoma?
No hematomas, infections, yes. But that's if you as a patient is not taking care and living in unhygienic conditions, then yes, you can get infections. But otherwise, it's known as a microsurgery. Yeah. So there's really no downtime to it and no infections.
I want you to help us debunk a myth. Mm-hmm. There's a lot of people who say when you cut your hair, it grows faster and thicker. Is that true?
To a certain extent, yes. Because when your hair is grown too much, it tends to get dead at the end. And you'll see stuff like split ends, rough hair at the bottom. So yes, if you're cutting it, then it does sort of allow the growth to be a little faster. But technically, so to say, if you want thicker hair, fuller hair, then you need to work on it with supplements or, just doing some natural stuff that allows the hair to be healthy.
Amazing. You've mentioned supplements.
Yes.
We have so many people selling hair growth oils. Does that work?
No, it doesn't.
It doesn't work.
No. So it may help to a certain extent because it's just nourishing the hair. But that myth about, if you're bald and it's going to regrow your hair completely, that doesn't work.
It's a lie.
It's like applying fertilizer to a barren land. Nothing is going to grow.
You had that right. The doctor said it. And there's also another statement. They say that if you eat these oils, if you eat them, it does help.
Again, to a certain extent, yes, but you can't be drinking like 1 liter of oil every day too. So there's a limit to it. Yeah. Whatever you will eat or consume, even if it's just foods or oils, it will help a certain extent, but it's not going to do justice to what a treatment would do or other supplements would do, because at that time we're giving you what's right for the hair to grow. And these food or oils is just basic. Yeah. And it's limited.
It's limited.
Yeah.
So it's advisable to just get a hair transplant and look amazing.
Yes.
Instead of going for the oils and eating gallons of oils. All right, let's go to the next one, the most famous one. Facelifts. I know that's very broad, but once you say facelifts, most people know Botox. Could you also tell us what other things you can do apart from Botox and fat injections? What else? What other options are there?
So when we talk about facelifts, we do something called a non-surgical facelift, which is also known as a thread lift. And we insert a product called threads in your face, which are dissolvable. So it's basically like stitching your face, but non-surgically. So we're not cutting you open, but we're lifting all the sagging and all the fine lines and wrinkles. And so to say, Botox is only done for the upper face and the neck. So ideally, when you're sagging at mid-face, then you can't do Botox. Fat injections only work for certain profiles, because it's only when you've had extreme fat loss is when you do fillers or fat injections. But if it was for you, for example, just an example, I wouldn't do fat injections or filler, because then it bulks up your face and then your body is smaller, so you look funny. So there has to be appropriate judgment for what needs to be done. But the non-surgical facelifts work really well because it's just inducing collagen. Collagen is the elasticity of your skin. And so you're just trying to restore the collagen in your body and make the face tighter.
Does it like run off after a certain period of time? You need to come back and redo it again, or is it permanent?
No, it lasts 2 to 3 years, depending on your lifestyle as well. If you have a really stressful lifestyle, if you have a bad lifestyle in terms of diet, smoking, alcohol, then it will contribute to it being a lesser time. But standardly lasts about 3 years, and then you only come back for a maintenance touch-up, but you don't necessarily need to do the whole facelift again.
Which is the most common one?
For me, my specialization is a non-surgical facelift. There's still a lot of stigma about Botox, still a lot of stigma about fillers. So it will take some time, I guess, to raise that awareness that Botox is not bad. And I think because we've all just watched too much on TV, especially, series like Botched, people just think that, Botox is bad, but it's not actually. If done in the right way and the right amounts, then it actually makes you look really good.
So it's safe to say that it depends on the practitioner.
Correct.
Amazing. See, guys, I'm getting it. So Botox is a form of toxin, right?
Yes.
But it doesn't necessarily mean that it's harmful to an individual.
No. It's a toxin that's made from bacteria, and bacteria is not really bad for your body. There is also some good bacteria, although, yes, this is bad in a way because it stops the movement of your muscle, but it's only temporary. So it will only last 4 to 8 months, and then you come back to where you are, so you get the Botox done again.
Well, it's good you've also mentioned movement of muscles. Why do some people why don't they have like facial expressions when they do like too much Botox?
Yeah, that's it. They've done too much. So when they're over Botoxed is when now you have no movement at all.
Yeah.
Like I have Botox on right now, but I can still move my face.
Yeah, totally.
So that's how it is. If you do it in the right way, then you can still move the muscles, but you've gotten rid of the wrinkles. But a lot of people overdo it. It can come from the practitioner, or it can come from the patient. Sometimes patients demand too much, and they'll tell you exactly what to inject, where to inject, and how to inject it. So yes, there is that educated part of patients who do demand too much. But
so if anyone has done a little bit too much Botox, is it reversible?
Yes, as I said, it's going to go away between 4 to 8 months. So in 4 to 8 months, it's going to reverse.
And the muscles will go back to their normal movements?
Yes, they will.
All right. Have you forgotten anything else about facelifts?
No.
Pain management. What is that? Like how? Okay, just explain to us when someone comes here for pain management, what exactly are they coming to get rid of, and where mostly?
Okay, so pain management is basically stem cell therapy. That's what I do for pain management. It's not my specialization, but because I've specialized in stem cell therapy, I just help out my patients who deal with chronic pain. So pain can be anything. It could be damaged muscles, it could be post-surgical, it could be post-accidents, it could just be natural pain like patients suffering from arthritis. So we literally treat the whole body. It could be anywhere from the head to the toe. And I commonly see a lot of patients